Thank you for joining us on Health News. I am Yomi Otaigbe. Good news filtered in last week when the president of the Joint Health Sector Unions, Comrade Ayuba Waba, announced the suspension of the almost 3-month-old strike by health workers in Nigeria. Some of the health workers have been seen at work, but the issues that ignited the strike remain unresolved. This week on the program, we'll be revisiting these issues. But first, a look at the stories making the rounds in the health world, beginning with the need to strengthen Nigeria's primary healthcare system, which is described as the bedrock of healthcare, but one faced with several hindrances, which include insufficient number of medical personnel, as well as their uneven distribution. A nurse educating mothers in their local language on the importance of immunization at a primary health center. PHCs are supposed to provide education to the people concerning prevailing health problems and the methods of preventing and controlling them, promote proper nutrition, maternal and child care, including family planning, immunization against diseases, and provide essential drugs. But in Nigeria, these basic health services are lacking in most primary health centers, especially in the rural areas.
70% or even above 70% of our people live in the rural areas. And this is where primary health care resides. That's the first contact of health care to our people, is primary health care. But over the years, this sector of the health economy has been neglected. The Constitution devolves primary health care to the local government system level. And you know that the local government level is the third tier of government. Of the 3 tiers of government, federal, state, and local government, you know that local government is the weakest. Local government has the least resources. But local government is the one saddled with the responsibility of taking care of 70% of the health of 70% of Nigerians. So you see that the arithmetic is wrong.
While some primary health care facilities are being upgraded in Nigeria, most are in various states of disrepair, with equipment and infrastructure being either absent or obsolete. Manpower is also a challenge. Yet, the PHCs ought to be the closest to the people in terms of easy access to health services.
If they can bring a permanent doctor to this health center, it will be okay. Though the doctor that is in there is a copper and the doctor is trying very well. It didn't even look as a copper.
So what will it take to get the primary health care system up and running effectively and efficiently in Nigeria?
What we need is political will. We need the executive governors to rise up to the task. Infrastructure has to be developed. They have to be maintained. Staff, adequate staff, have to be recruited. Technical manpower. Then provision of drugs and other consumables have to be done. If we reach the 70% of people that are in the rural areas with effective, affordable healthcare delivery, then only a little will be left to be taken care of at the secondary and the tertiary level.
Although primary health centers may be in most parts of the country, the rural population in Nigeria is seriously underserved when compared with their urban counterparts. More attention will be required in that area, while the overhaul of the entire primary healthcare system is urgently needed. In other reports, Brazil's health ministry is using Tinder and Onnit to target young people that use smartphone apps to meet sexual partners in a newly launched campaign to help prevent the spread of HIV/AIDS in the country. Hornet is almost exclusively used by gay men, while Tinder is used by both heterosexual and homosexual men and women. Health Minister Arthur Chioro announced the plan as part of the ministry's campaign to prevent sexually transmitted infections and AIDS for Carnival 2015. The ministry created profiles as people interested in having sex without condoms. When an app user interacts with one of the ministry's profiles, a message is immediately sent back to the user explaining the importance of using condoms to prevent the spread of sexually transmitted infections. Government statistics show a 40% increase in new HIV cases among 15 to 24-year-olds from 2006 to date. In addition to the smartphone campaign, the Health Ministry is distributing 70 million condoms ahead of Carnival celebration, which runs from February 13 through February 17. Expectant women in Nigeria can learn from this next report. An updated UK guideline for women trying to have a baby and those in the first 3 months of pregnancy indicates that this group of women should not drink any alcohol. The Royal College of Obstetricians and Gynecologists had previously said a couple of glasses of wine a week was acceptable. It now says abstinence is the only way to be certain that the baby is not harmed. There's no proven safe amount that women can drink during pregnancy. The updated advice now rhymes with guidelines from the National Institute for Health and Care Excellence. In the U.S., experts say there is no safe time to drink alcohol during pregnancy. Drinking alcohol may affect the unborn baby as some will pass through the placenta. Around conception and during the first 3 months, it may increase the chance of miscarriage, says the Royal College of Obstetricians and Gynecologists. 1 unit of alcohol is about half a pint of bitter or 4.5% lager or single measure of spirit. Meanwhile, scientists at the Massachusetts Institute of Technology in the United States of America are hopeful that smart insulins, which are undergoing trials, could revolutionize the way diabetes is managed. Instead of repeated blood tests and injections throughout the day to keep blood sugar in check, a single dose of smart insulin would keep circulating in the body and turn on when needed. Animal studies show the technology appears to work, at least in mice. PNSA Journal reports that the scientists plan to move to human trials soon. Experts, however, caution that it would take years of testing before treatment could become a reality for patients. There are 2 main types of diabetes. In type 1, which accounts for about 10% of diabetes, the body's immune system destroys the cell that make insulin. Type 2 diabetes is when the body either cannot make enough insulin or the body's cells do not react to it. Insulin treatment is always needed for type 1 diabetes, while if you have type 2, you may be able to control your symptoms by eating a healthy diet, exercising regularly, and monitoring your blood sugar. Diabetes experts have been searching for ways to make blood sugar control easier and more convenient for patients, which is where smart insulin comes in. There are a few different types in development, but all are designed to automatically activate when blood sugar gets too high and switch off again when it returns to normal. I guess most people living with and managing diabetes will be glad to welcome the smart insulin whenever it becomes a treatment option. We'll take a break now, and when we return, I'll be joined in the studio by the Vice President of the Joint Health Sector Unions.